All right, I'm going to move us along with our agenda. Next, we have a presentation from the LA Best Babies Network team, Support for Changemakers, how LABBN supports home visiting systems in LA County. To start us off, I am going to pass it on to our administrative team, starting off with Larissa Malik, who is our Operation and Grants Manager. Larissa, it's all you. Thank you.
Thank you, Charlene. Good morning, everyone. My name is Larissa Malik, and I'm the Manager of Operations and Grants at the LA Best Babies Network. I am in charge of the accounting and finance for our grant-funded and non-grant-funded programs that we have within LABBN. My team consists of our office manager, Jessica Perez, and our administrative coordinator, Vanessa Reyes. As the administrative support team, we collaborate with all the teams within LABBN and FSOA Network to provide administrative support when needed. We handle logistics for collaborative projects and LABBN's organizational operations. We manage, purchase, and monitor program materials and distribution of these materials to the Welcome Baby sites. Lastly, we serve as a liaison leader between California Hospital Medical Center and LABBN. Now I'm going to pass this to Jessica to continue with our accomplishments for this fiscal year.
Thank you, Larissa. So hello, my name is Jessica Perez and I'm the office manager at LABBN. And before we highlight our collaborative efforts with our other teams, we want to highlight our team's accomplishments. So LABBN saw some growth in 2020. In the midst of the pandemic, we were able to hire and onboard 5 additional team members. And we also have an open position if you know anyone. Welcome Baby orders. So in the 2021 fiscal year, we processed 204 Welcome Baby orders for the Welcome Baby program. That totals to over 46,000 items purchased for Welcome Baby sites. We also received some donations, and our team was fortunate enough to get a large amount of toy donations from our Infantino vendor representative. We also received a generous donation of nursing pads from a local vendor, and we were able to distribute the toys and nursing pads to home visiting and Welcome Baby sites. And our Summit gift boxes, which most of you received, our team helped source, purchase, and assemble over 500 gift boxes for the Family Strengthening Network. And we'd like to thank the policy and communications team that assisted us with the assembly. The boxes were were distributed to sites through a drive-through event at California Hospital. And we appreciate each and every one of you Changemakers and hope you enjoy your gift boxes. The last highlight for our team, we went paperless in 2020. And to accomplish this, we created an electronic binder to help with the transition. And we plan to continue to use this method to further reduce our carbon footprint. If we can go to the next slide. And here is just a brief overview of all the items that we purchased for the Welcome Baby program throughout the 2021 fiscal year. We purchased a total of 48,876 items, and those were distributed to families across LA County. And I'd like to introduce Vanessa.
Thank you, Jess. Good morning, everyone. As Jess and Larissa have introduced me, my name is Vanessa Reyes. I'm the administrative coordinator for the LA Best Babies Network. I am one of the 2 Vanessas on the team, as well as one of the 5 newest members added to the LABBN team in 2020. And I would like to highlight some of our collaborative successes. Martha, could you go to the next slide? Thank you. So of course, we all know collaboration wins because that's why we're all here today. So I'd like to highlight some collaborative efforts that we had the opportunity of working with the technical assistance team, also known as TA team, which is Martha and Kayla, where we were able to secure and distribute over 200 Chromebooks that consist of a Chromebook laptop, hotspot, gift card for internet services to families in our home visiting programs who had expressed a need for technology resources. We were also fortunate enough to able to assist with data collection for the COVID-19 site assessment surveys, as well as record over 70 meeting minutes that were made and distributed throughout the fiscal year of 2020 to 2021. And in collaboration with our communications team, we successfully sent out 52 weekly newsletters to the Family Strengthening Network that contained educational events, workshops, and trainings for our early childhood professionals, home visitors, and parents and families within Los Angeles County. And in this past quarter, we assisted with distributing provider incentive items to our Welcome Baby programs as outreach specialists. Lastly, on behalf of our team, we would like to thank you all for your amazing work, and we look forward to supporting you all more in the coming years. And now I would like to pass it over to our consortium and policy team, Jana and Laurel.
Good morning. My name is Jana Wright, and I, along with Laurel Murray, make up LABBN's policy team and the backbone support team for the LA County Perinatal and Early Childhood Home Visitation Consortium. Our presentation today is broken into two parts, the consortium and policy. We'll start with the consortium. So the goal of the consortium is to bring together all the parts of the home visiting system, from the staff, advocates, and funders to work towards expanding home visiting. The consortium has 5 work groups, and I'll be sharing highlights of each work group. The first is the advocacy work group, whose biggest accomplishment of the past year was a letter campaign in support of DMH-funded home visiting. Since officially joining the consortium in October of 2020, the African American Home Visiting Engagement Work Group has been hard at work developing an action plan. We're particularly proud of this work group as it shows our dedication to continuing our anti-racism work. The Best Practices Work Group administered the program self-assessment survey to sites this year. The Data Work Group designed and collected results from a pair of surveys during the pandemic for frontline staff and home visiting managers. And lastly, the Referrals Work Group completed a series of surveys for families regarding their experiences with virtual visits. Some other highlights from the consortium include our new newsletter. Could you go on a little bit, Martha? Thank you. Our new newsletter to streamline communications, the weekly rundown. This newsletter is sent out to nearly 400 individuals at the end of every week. And the consortium is growing. We have accepted 5 new member organizations over the past year. So if you're interested in joining the consortium or getting involved in any of these 5 work groups, please feel free to reach out. Now for LABBN's policy overview. Policy is important to our families because it shapes their worlds. Everything from how much paid family leave they can take to Medi-Cal benefits is affected by policy. This year, we tracked 19 bills, submitted comments for Title X Family Planning Program and Family First Prevention Services Act funding. We also submitted 12 letters of support. Other highlights from this year include providing information for the congressional hearing on paid family leave and creating the first ever LABBN legislation tracker. LABBN's policy team was also able to collect 20+ letters over a 24-hour period in support of a recent home visiting Board of Supervisors motion. And next, we'll hear from Steve and Amy of the Marketing and Communications team. Thank you.
Hi, everybody. Well, as you can see, there's a whole lot going on here, and we don't have a whole lot of time for this agenda item, but I just wanted to highlight some of the things that Amy and I have been working on. You probably know about many of them because we find our way into your email inboxes quite often. So there she is, Amy Miramontes Franco, my co-worker, and I'm Steve Nish. We work with communications and marketing and outreach for LA Best Babies Network. So let me just zip through some of this stuff. We have a page on the Stronger Families blog, a whole section now divided into all kinds of categories of resources related to COVID-19, everything from rent, utility assistance, food giveaways, vaccine information, and how to talk to folks about vaccines. It's all there, and we're going to follow up with links to all this stuff. I know really pretty much all this is online, so I'm going to send that later. Once again, I'll find my way into your inbox. New Welcome Baby book, we've got it. It's actually, I've got it right here. Let me show you the real deal, not just online. The whole thing is done and available. It's fully revised, will be available online as well, not just for Welcome Baby, of course. It's got great resources for HFA, PAP programs, anybody who wants them. Everything from having a healthy pregnancy, childbirth, through positive parenting, home safety, breastfeeding, on and on. And in the book, actually, we've got, I wanted to mention the whole new sections and even a QR code where folks can scan and find their new resource library, which leads me to the next item, the resources for families. A whole section that's organized along with the Welcome Baby book, covering all sorts of things that you can share with parents, guides, tip sheets, all sorts of stuff. WelcomeBabySupport.org, that's the next item down on the bottom left, is our new website where you can share with parents. Anybody who's pregnant can easily connect with an outreach specialist through this website. And even if they're not delivering at one of those Welcome Baby hospitals, they'll find their way to the consortium's e-directory, which has all sorts of other home visiting options for families. WelcomeBabySupport.org. Send them there, please. And lastly, just wanted to give a quick shout out to the outreach folks that we work with. We've been having monthly meetings in addition to the quarterly webinars that we do, and all kinds of great ideas have come out of there, and a lot of great collaborative work. So hats off to outreach. And I think that's all I've got. So I'll pass it along to another couple folks I'm sure you all know well, the training mavens and our former Tapslandia podmates at LABBN, the great Terry Mae Anciano and Patrick Flippin Weston.
Thank you so much, Steve, for your awesome introduction. So hi, everyone. I'm Terry. I am one of the Public Health Research Associates and Training Coordinators, specifically for the First 5 LA funded staff. I may look familiar to you with your cohort trainings.
And I am Patrick Flippin Weston, Public Health Research Associate and Training Coordinator for County Funded staff. Just a huge thank you. We did it. Thank you for riding this virtual wave with us. Thank you for always being participative, always being flexible when it came to technical advances, and never getting tired of us asking you to break out into Zoom rooms. So we couldn't have done this without your amazing participation and engagement.
We just wanted to spotlight that we did transition cohort trainings virtually, which is the first time for all of us, especially in LABBN. So in March 2020, we had to switch over every training that we have, over 30 trainings now, to the virtual platform on Zoom. First time all of us are using Zoom. So we wanted to thank you as well for transitioning with us.
So we did add new trainings during this virtual transition, which included fatherhood engagement, grief and loss, and breastfeeding support. We also held our first virtual peer-to-peers with our First 5 LA staff, each kind of totaling 200 in attendance.
And for the new staff trained for our current cohort, 18 and 19, we trained over 107 staff. And this is just a picture of one of the trainings we did with our group, and we wanted to highlight them as well.
Yay. And our original cohort, the curriculum started off with 26 trainings, but now we have 30, so we've expanded, yay.
And we wanted to highlight all the hours of training you have done with us. So altogether and more, you've done at least over 200 hours of training with all of us. So a big round of applause to all of you. And we have a little surprise from some trainers that wanted to also congratulate you on all your hard work.
I'm happy to be with you all today to celebrate your successes over the last year, your successes with the families you work with, your commitment to your work, and especially your commitment to the trainings that you undergo. So congratulations, keep up the good work.
Patrick and Terry gave me half a minute to express my deep appreciation for you and the work that you do. All of us go into this work to make a difference, and you guys do that every day in the middle of a pandemic. And I think you are just amazing. Keep up the good work.
I'm thrilled that you're taking time to celebrate your success in providing home visitation services. You may remember that I'm a certified nurse midwife in 2 of our local hospitals. Whenever I see one of you going into a mommy's postpartum room to introduce her to your home visitation program, I know that she's in good hands. Please, please, please continue to do this important work. Home visitation truly is a secret sauce that is getting us nearer to our goal of optimal pregnancy and interconception care. Blessings on each of you as you continue this important work, and enjoy your summit.
So thank you to all of you from all of us and all the trainers. I will turn it now over to our other teammates in the TA team, Martha and Kayla.
Okay, thank you all so much for being with us. Good morning. We're really excited to celebrate your hard work this past fiscal year. My name is Martha Bach. I'm a Public Health Research Associate on the Technical Assistance Team at LABBN'S Network.
And I'm Kayla Cockaband, also a Public Health Research Associate and part of the Technical Assistance Team at LABBN.
Kayla and I make up the TA team, and we work with the program managers and supervisors for Welcome Baby, HFA, and parents as teachers. The goal of our work is to support best practices and improve programmatic outcomes. And we reach this goal by first asking you what your support needs are, what topics you need more information on, what resources you need, etc. And then from there, we do our best to address these through targeted technical assistance.
And as you know, we have a huge network of home visitors all over the county. So we need various ways to assess the needs that you have. So this past fiscal year, we assessed needs through a series of online surveys, surveys that included the TA needs survey, COVID-19 site assessment surveys, client satisfaction surveys, and monthly site surveys, all of which helped us identify the top priority technical assistance needs, gather information regarding COVID-19 specific needs, identify and provide resources, and gather information about the policies and procedures in place across sites, and measure client satisfaction with home visits.
So once we have heard from you about what it is that you need, we create various trainings, webinars, and resources, and we host meetings to support you in your work. This past fiscal year, we hosted a number of trainings and webinars on various topics that you requested. And we also created resource guides and protocols to support virtual home visiting, and hosted meetings in which you could interact with and learn from your peers about their successes in virtual home visiting.
Finally, we would like to share a few of our successes this past fiscal year, which included a published paper in the Maternal and Child Health Journal by my lovely coworker, Martha Bach. Together at the 2021 Virtual National Home Visiting Summit, we presented a poster on the transition to virtual home visits and a panel presentation on African American engagement and implicit bias alongside our colleagues, LABBN Director Charlene Ghazalians and Director of Policy Jana Wright. Lastly, we collaborated with our administrative support team on the 200 laptop bundles that were distributed to families.
You are the reason that we do this work. Your dedication to supporting the families in our community inspires us to work as hard as we can to support you. We are so incredibly lucky to be able to provide you with support as you work diligently to help families in LA County.
We look forward to another fiscal year working with you and supporting your teams. And now I'm going to hand it off to Jonathan from our data team.
Thank you, Kyla. Thank you, Martha. And good morning, everyone. So on behalf of the data team, I would like to thank every single one of you for your resilience through this very difficult year. Despite the pandemic, and I think I speak for everyone when I see this, our work has not stopped. That being said, I would like to go over, if you're not yet familiar with our team, I would like to go over every individual that makes up our team. Starting with our amazing manager of data and evaluation, Delisa Yun, our super bright senior data analyst, Monica Charles, the easygoing, cool and collected data analyst, Brandon Kra, the formatting queen, data of QA and project specialist, Vanessa Delgadillo, the jovial database trainer and support specialist, Osvaldo Lopez, and myself, database trainer and support specialist as well. So again, as I mentioned, despite COVID-19, our work has not stopped. So I do want to share some fun facts that will give you perspective on what we have accomplished on the database. So we have responded to and we resolved over 413 support tickets. We have trained over 200 welcome baby and home visitation staff on the Stronger Families database. And we have housed, or we've maintained over 500 database users on the Stronger Families database. Finally, the data team is the largest department within LABBN. Now I'd like to pass it along to Vanessa.
Hi everyone, my name is Vanessa Delgadillo and I am the OG Vanessa here. So I'm moving along on our reporting side. We welcome our new data analyst, Brandon, and we also continue to analyze trends during the pandemic. We also revamped national model reports to accommodate all these changes that were going on through the pandemic. And we also supported our funder reporting and updates. And moving on for the Stronger Families database, we also welcomed a new Stronger Families database trainer and support specialist, Osvaldo. And we successfully transitioned our HV database training virtually. So now all our database trainings are virtual. And we also developed data fields that were needed for the Welcome Baby study that has started now. And moving on to CQI, we continue to monitor, share, and discuss data gaps and successes and collaborate with the network to make any improvements. We also continue to meet frequently with First FLA and DPH leaders to build and support a healthy home visiting system. And we also collaborate with our external evaluating teams for welcome baby studies such as CDSS DPS evaluation project. So those are some highlights of what we do on the reporting and database side, and also CQI, and how we continue to collaborate with all our other funders. And now I will pass it on to Charlene.
Thank you so much, Vanessa, and a huge thank you to the LA Best Babies Network team for spotlighting all the work that we have accomplished for systems building and capacity building in LA County with the help of our funders and with the help of all of you as well. Before going any further, it is Mentimeter time. So I'm going to pass it on to Martha to lead us through our icebreaker. Martha?
Okay, sounds great. So if any of you haven't used Mentimeter, although I'm guessing everybody has, I will walk you through it. We love Mentimeter here, so we probably used it being with us. So what I'm going to do, for interest of time, we're going to skip this first one. We're going to go right to the meat. So if you've never used Mentimeter, you can open up a browser tab on your phone or on your computer anywhere. You go to www.menti.com. and it will prompt you to enter a code. The code is 69670204. You can see it at the top of the screen. And it looks like you're already figuring out how to use it, so that's great. And this is a way just for us to hear from you. So my question for you is, what is the one thing that you're most proud of from this past fiscal year? As people answer, it will start to populate the page, and I'll be able to scroll through them all, and we can see what people are proud of this year. Don't be shy. Tell us what you're proud of. Staying sane, development, adapting to working from home, while pregnant during a pandemic. Kudos to you, whoever put that in there. There's a lot going on. Resilience and commitment. Keep scrolling. It doesn't want to let me keep scrolling, but I'm sure there's tons after this. Keep going. Okay. Great, we'll keep entering that in. So what I will do at the very end, and this is for all of us to see, I am going to save all of these and we'll send them out with the materials after the summit so you can see what it is that everybody's proud of this past fiscal year. So we'll send those out to you afterwards. Charlene, back to you.
Thanks so much, Martha. And I'm going to pass it on to our raffle master, Vanessa Reyes. It's time to do 3 raffles. Vanessa, can you pull out 3 raffle winners, please?
Of course. Thank you, Charlene. 1 second. Let's see who our first winner of the day is. Our first winner of the day is Billy Rosas from El Nido Family Center.
Congratulations, Billy. Make sure that we get your email address because we are going to send you an electronic gift card.
Perfect. See who's next. Our next winner is Larisha Floyd from CCRC Palmdale.
Wonderful. Congratulations, Larisha.
And last, our last winner for this round is Rosa Ora Garcia from The Whole Child.
Wonderful. Congratulations to our 3 winners. Make sure that the LABBN team grabs your email address at some point during the conference. Within the next day or so, you'll receive an electronic gift card from us. And again, congrats for winning. We've still got 7 more opportunities to win, so don't worry. There's still time.